Is your low vitamin D due to a genetic issue? Let's find out. Hello and welcome to the Ask Dr. Pickel show. And today we are going to talk about genetics and vitamin D. There's many patients who they're taking their vitamin D. Their vitamin D looks good on their blood test. And it's like, hey, why aren't they feeling any better? What's going on? Their immune system's still low, or they still feel kind of down, or they crave the sunshine, or just an overall just something's not right in my body. And we've got to start to take a look at this a little further, especially when people have autoimmune conditions or chronic health issues. We've got to look for a potential genetic issue called a vitamin D receptor polymorphism. So I know that's a big word, but let's dive right in with this. All right. So basically, when you take your vitamin D, which right here, so we take our vitamin D, that of course has to go to the liver and the kidneys and turn into the active form of vitamin D, which is right here. And then that's the one that actually goes to your cells, which then ends up in the nucleus of your cell and affects your genetics, affects your genes and DNA, RNA replication. So very important that all this works properly and smoothly. But here's the problem. If you have a genetic issue called VDR, or vitamin D receptor polymorphism, or a vitamin D receptor SNP, then this is a problem. This means that your body is you're taking your vitamin D, it's getting in, it's turning into this active form. So even if they test that, it's looking good. But then when the vitamin D cargo ships that carry vitamin D through your bloodstream get to the cell receptor, which is like a little doorway on the cell. Let's think of it as like a boat dock where they offload the vitamin D cargo to take it into the cell. So if that doorway, if that dock has problems, it isn't going to get into the cell. This is what this genetic issue does. It affects the vitamin D receptor. It actually makes it less efficient. So if you have this genetic issue, this can lower your ability to get vitamin D into your cells by up to 30 to 70%. Not good. So it's like, hey, I'm taking my vitamin D. What the heck? Why am I still feeling this way? And why am I getting these other symptoms? So this is what has to be looked at. Do you have this gene? Do you have this problem? Because then again, it's not getting into your cells. The receptor isn't doing its job. And then it starts to just continue to build up in the bloodstream. And now it can start to even look like, hey, my vitamin D is pretty high here. What the heck? So then the thing that we would need to do to find this out, number one, is do a genetic test and find out, do you have that vitamin D receptor SNP, that polymorphism, the issue with the cargo dock, so you can't get the vitamin D off the ship into the cell. So we need to look for that. And if that is positive, then we got to say, okay, then is it homozygous or heterozygous? Because that would determine maybe the severity too of the issue. Do you have one gene affected or both genes affected? So then we can even find out more from that. If you do have all this, if we do find out that you are positive in all this, there's some absolute things that you can do. The number one thing to understand is genes are a tendency. They are not your destiny. So you don't have to live that way. If you have this issue, when those genes are causing problems, you've got to find out what's activating that gene, what is causing it to express incorrectly. And this could be things, anything inflammatory can cause these genes to have problems. And this would be like heavy metals, chemicals, infectious agents, something in your body that your body's not getting rid of on its own that is stoking these genes, that's keeping that problem gene going in the wrong direction. So you get rid of those things, calms down, and now that gene says, hey, yeah, I might have a problem, but now I can maybe work it 20% or 30%. I don't have to go all the way down to 70% inefficiency. So this is kind of how, and maybe even better than that. So it's hard to say how much better you can get with this until you try. Now, the other side, the other thing that has to be done while this is having problems, especially if there's still, if there's inflammatory aspects to this, is you've got to still get keep your vitamin D up, even though you might be taking quite a bit and your doctor says, hey, don't let it get over 100. That'll cause some problems. Well, then you've got to say, hey, doc, here, look at this. I've got a vitamin D receptor polymorphism. And then they should say, oh, hey, well, no problem then. Let's take this all the way up possibly to 120 on your vitamin D. So now you supersaturate, you oversaturate with vitamin D, which at this point we want, because if you oversaturate those receptors, those little doorways, what happens is you sneak some through. You actually get it through the door because you've oversaturated that receptor. Now, again, that may give you time. If you oversaturate for a little bit, that'll give time for you to get rid of some of the inflammatory things that are causing the gene to malfunction. And then you can start to decrease dose after time goes by. And then you should notice the actual difference from taking vitamin D. Because a lot of times when people have this, they'll be like, yeah, I take vitamin D. My level is through the roof. I'm like up at an 80, 90, 100. I don't feel a difference. I don't even know. And that's, so this is commonly what can occur. It's not getting into the cell, especially if you're already having a chronic health condition, an autoimmune issue, you're more susceptible to that. Now, I would also say if you're taking vitamin D, especially at these levels, vitamin D needs some assistance and it needs some help. So your other fat solubles, vitamin A and vitamin K2 can also be very helpful and even crucial for helping this matter out and making things work better. All right. So I would say overall, this is something to look at. Maybe not for all of you, but for some of you who are concerned that this might be an issue. I think, again, getting your blood tested, get the vitamin D tested, get the vitamin D 125 tested. If both of those look great, then the vitamin D receptor may need to be tested with all of this. But I would say this more needs to be done on a regular basis, this type of testing, if you do suffer from chronic health issues that nobody's finding answers for, or autoimmune conditions. So that will be where it is all at. All right. Well, God bless. Have a wonderful day, and I will see you on the next video.